Good morning. Hello, hello. So glad to see you back joining me for another video. Today, I want to talk about what happens when you continue to come to the doctor, to the rheumatologist, and you don't know what your diagnosis is, or you don't have a specific diagnosis like rheumatoid arthritis or lupus or psoriatic arthritis. Let's say that you've been having the conversation about lab work and understand that something is happening. Something doesn't feel right. Your body doesn't feel right, and there are symptoms that are signs of something going on, but you can't quite pinpoint a name for it, or your doctor doesn't offer a name for what you're experiencing. Let me just tell you that that's actually okay. There are times when people come and see us and they have symptoms that remind us of a certain type of condition, but don't necessarily have the blood markers to show that condition or disease, like something called ankylosing spondylitis. So people can have a positive lab or gene marker called HLA-B27, but not necessarily have back pain or abnormal imaging. But they can have joint symptoms like stiffness or sometimes swelling of a finger or a toe, or something just doesn't seem right. Like you can have tendinitis without specific swelling. And we use all of those symptoms together to make our best diagnosis or our best assessment of what you're going through. But sometimes we just don't have a name to put on it. Or we say, your symptoms are acting like this, or you have features of this. And then we use a combination of medications, or one or two medications that help treat those symptoms. And the goal is that you feel better. The goal is that we treat the thing that you came in to see us for. But sometimes that doesn't always have a name, at least in the beginning. So I'd like to offer to you, those patients, if you're one of my patients and you don't have a certain diagnosis or name, I'd like to offer that that's okay, that we're still working towards getting you feeling better, because the end result is not so much what we call you, although it's comforting to know that you identify as something, right? We all want to belong to a community, to feel like we have a sense of togetherness. But the rheumatology community is a very broad range of conditions, and those spectrums are from very mild to very severe, and everything in between. And so we don't always have a name in the beginning. And so it might take a couple of visits. It might take 6 months or even a year to say, aha, this is what's happening. And then we associate it with a name. So I just want to encourage you to keep coming to your appointments, keep showing up, keep a diary or a log of the symptoms that you feel and the struggles that you're going through, because that's how we can trace things. That's how we can keep track of what symptoms are the most prominent for you. So if you have joint pain without swelling specifically, or you have a rash that has not yet been defined, or you have just feelings that, again, something isn't right. If we've ruled out autoimmune things specifically, then we can say you probably don't have something autoimmune. But if your symptoms are like something else, then keep going, keep digging, and keep trying different combinations of medications to see which one sticks, which combination you feel better with. Because ultimately, in the end, what we want is that you feel better. And the medications that we pick are just combinations of things that people with those identifiable conditions respond to. So I hope I didn't make this even more confusing, But I want to encourage you that it's okay if you don't have a specific diagnosis. If you're working towards something, that's what's important. And time will tell. Time is often the best indication of what your condition actually is. So just keep up with it and keep going. All right, we'll see you next time. Thanks again for joining today. Bye-bye.